Can you prevent roseola in infants? Roseola is a common viral infection that affects infants and young children. It is mainly caused by human herpes virus 6 and sometimes human herpes virus 7. Since there is currently no vaccine available for roseola, complete prevention is not possible. However, there are several ways to reduce the risk of infection and limit its spread. One of the best strategies is frequent hand washing. Teaching children and caregivers to wash their hands thoroughly and regularly can significantly reduce the transmission of the virus. Make it a fun routine to wash hands before meals and after playing. Another important step is to avoid sharing personal items. This means not sharing utensils, cups, toys, or anything that might carry saliva or respiratory secretions. Keeping personal items separate can help keep germs at bay. Encouraging children to cover their mouths and noses when they cough or sneeze is also essential. Using a tissue or the elbow can prevent the virus from spreading through the air. This simple act can make a big difference in keeping others healthy. If a child develops a fever or rash, it is best to keep them at home. Roseola can be contagious before symptoms appear, but once the rash and fever develop, the child is generally no longer contagious. Keeping sick children at home helps reduce the risk of spreading the virus to others. Infants are at the highest risk for roseola between 6 and 15 months of age. During this time, maternal antibodies that provide some protection begin to wane, making them more susceptible to infections. In summary, while you cannot fully prevent roseola due to the lack of a vaccine and its contagious nature, practicing good hygiene and minimizing contact with infected individuals can help reduce the chance of infection in infants. If you suspect your child has roseola, or if they have a high fever lasting several days, it is always best to consult a healthcare provider for guidance. They can provide the most accurate information and support for your child's health.